All right, welcome back, everybody. We are continuing the conversation about vaccination, and today we're going to be chatting about what it means to be fully vaccinated and all the implications within that realm as well. With me this morning is the County Medical Officer of Health of St. George East, and his name is Dr. Osafo Fraser. Good morning, Doctor.
Hi, good morning, Carrie, and all your viewers.
Thank you for being with us this morning. Now, I have a long list of questions because we're speaking about being fully vaccinated, and we've seen it in other countries where, well, in some states at least, let's say in the US, where people who are fully vaccinated are allowed to go outside without wearing masks. They no longer have to social distance and these things as well. But for Trinidad and Tobago, what does it mean to be fully vaccinated?
Well, Trinidad and Tobago, we have got just those WHO approved vaccines. And right now, the ones we have, they require you to get 2 doses before you're considered to have got the requisite amount of doses. But to be fully vaccinated requires time. So you need to have been vaccinated for at least 2 weeks after your second dose to be considered fully vaccinated.
And in the case of a vaccine like Johnson & Johnson, with there's only 1 dose, how long is it to be considered fully vaccinated?
Yeah, it's the same length of time, except that in Johnson & Johnson case, you don't need a second dose. Right. So it's after that 1 dose, 2 weeks after that 1 dose, you're considered to have the length of time required for your body to mount the immune response it needs to be able to fight off the coronavirus.
Now, I was listening to a BBC program quite some time ago, and they outlined that people who are vaccinated can be reinfected. How true is that?
Yeah, that's true. That's true. I think none of the vaccines boast that you can't be reinfected. The boast from the vaccine, and it's more than a boast at this stage. It's a matter of evidence in many cases. The boast is that once you get vaccinated, the vaccines work to protect you from getting very ill, getting to hospital and dying. And that is what we see both in the trial and what we see in the real world setting once it starts to be deployed.
Vaccines in the past, the layman would have thought that, the vaccines you get early in your life, measles, mumps, rubella, these things as well, it was thought to completely prevent it. But we're not seeing the same for COVID-19 vaccines. Is it true that these previous vaccines fully prevented one from getting those diseases? And if so, why not the COVID-19 vaccine?
Yeah, those vaccines worked in a similar kind of way. What a lot of them would have done is to stop you from getting symptomatic infection. And so once the virus gets into your system, the vaccines would have already caused the body to prepare. And so it dealt with the infection very quickly, and you didn't get any symptoms.
Right.
But and it's the same thing with the COVID-19 vaccine. The speed at which you deal with the infection is much faster. The length of the amount of response is much more. And so you do not end up getting the symptomatic illnesses that you get from COVID-19, certainly the serious ones.
Right. Now, let's say someone was fully vaccinated, they happen to be reinfected. Can that person spread the virus to someone who is not vaccinated?
Yeah, sure. And I think we have limited evidence that suggests that the ability of that person to spread the virus is decreased after you have become fully vaccinated. The research is still ongoing, but I think there are some figures quoted somewhere between 40 to 60% ability to decrease the ability to spread the virus. In some parts of the world, we have seen that. So we know you can spread it, but we also know the evidence is emerging that the ability to spread it gets significantly decreased after you become fully vaccinated.
That's something that is heartening to know.
Yes.
At the very least, if you're fully vaccinated, you're very unlikely to spread it. Now, we can't take solutions from different countries and just superimpose it on any country, especially Trinidad and Tobago. And as I mentioned earlier, we've seen in the US, in some states, they have discontinued, fully vaccinated persons have discontinued wearing the mask and do have to social distance. But should a fully vaccinated person in Trinidad and Tobago still adhere to the 3 Ws?
Yes, of course, because what I just said. One, you can still become infected, and two, you can still spread it. And because of that, it's important to make sure that you are doing all the preventative things. And of course, that includes the washing of the hands, the wearing of the mask, and the watching your distance to make sure you keep that 6 feet between you and the other person. So those things are still very, very, very critical.
Would you say that we need to get to that herd immunity before we can even consider doing away with the 3Ws?
I would say I don't even know if we'll ever be able to do away with the 3Ws completely. But it's important to know that once you are, the more people that get vaccinated, it's the more that becomes even remotely a possibility.
Now, the vaccines have been described to have different efficacies and different efficiency. What's the difference between those two terms?
Yeah, so efficacy versus effectiveness. Those are the things that are in the domain. And efficacy refers to what the researchers found when they did the trials. And in the case of, say, for example, the Pfizer vaccine is known to be 95% the efficacy, which is during trial, this is what we found. Effectiveness refers to what happens once you deploy it in the real world and what are the real world findings. And in most cases, we find efficacy and effectiveness tend to be pretty much the same.
All right. Now, with the flu vaccine, for instance, persons usually have to get booster shots yearly because of the mutations in the virus. Would it be the same for COVID-19, or can one full vaccination solve the issue?
Yeah, I don't think we know that as yet. And there's research going on to determine if you would need a booster. It is likely that will be the case, but we don't know yet for sure. So the recommendation is still, for now, get your 2 doses if you're a 2-dose vaccine. And as the data comes in, we'll be able to pronounce on if you need a booster, say next year again.
Right. Now, we've seen variants emerge, from various countries. And there isn't so much information on which vaccines can protect from what variants. How worried do we have to be about that?
I wouldn't use the word worried, but we certainly need to be aware so that we are constantly tracking to make sure that we know which vaccines work well against what variants. And that is also data that will be coming in, and that research is constantly ongoing. And I think we need to make sure that we are up to date with that so that we know how what to expect. Right. And I know many countries, more than Trinidad, dealing with a lot of the variants. So a lot of the information will come from those countries where the variants are prevalent. So we're looking very closely to make sure that we're aware of what's going on.
Now let's speak of the care of COVID-19 patients, especially those who are doing home quarantining and they're taking their 2 weeks home until they get tested and whatnot. Some people don't live alone and they don't have and they have people around them. Is it safe to be in a home with a COVID positive person?
It is safe. Let me just start by saying it is not an easy thing to do if you are living at home with a COVID positive person. The process required for isolation, and I think we are all aware of that. So the advice we give is we take it into consideration the fact that it's a difficult thing. You have to make an effort, and I think that's right. the note there. But it can be done, and people do it. And they do it not just in Trinidad, but they do it all over the world.
But are they able to do it and not themselves contract the virus?
Yeah, sure. We have lots of examples of that.
Yeah.
And I think COVID-19, like all the viruses, the way to protect yourself is to provide a barrier between you and the virus. And I think the more we are familiar with how the virus spreads, it makes that process a little easier. So, for example, if you're living at home with someone who's COVID-19 positive, you want to make sure that there is a barrier between you and that person. And It's a mask on at all times once you're in the presence of that individual. You are maintaining your 6 feet distance. Once you have to use common utensils or a common bathroom space, for example, there's sanitizing done between time the person use it and you get the chance to use it. So anything that provides that barrier, that space, that let's stop the virus getting from you to me, those are the things that will help, and they have been very successful at helping. It takes a lot of discipline, a lot of effort, because you're accustomed living with this person, accustomed sharing the space without having to wash my hands after every time. But knowing that that person is infected and you're trying to prevent the infection from spreading gives the motivation to do what you need to do.
Definitely. Now, persons who are caring for COVID positive patients at home are not necessarily medical professionals.
Right.
You know, what are signs that individuals like that need to look for to know whether the person is deteriorating or improving?
Yeah, and I think signs, some of the obvious ones we have would be the shortness of breath or worsening shortness of breath. And so that person has a lot of difficulty breathing, taking a deep breath, lots of chest pains, sometimes lots of weakness and fatigue, to the point where the person you're caring for, they're unable to get out of bed, they're lying down a lot. It's very difficult for them to do anything. If that's worsening, those are big signs that we need to get some care more than the person at home can give.
Now, people who have COVID-19, they may be physically isolated from their families and whatnot, but especially for those who are going through the virus at home with their families, and they may put them in a separate room and these things as well. But what advice can you give to persons who are caring for those with COVID-19 at home to prevent them from feeling isolated and ostracized?
Yeah, and one of the things that you have to make use of is the technology as much as is possible. Stay in contact with them, even if it's talking to them through the doorway, using your phones, your Skype/Zoom calls, staying in contact with them on a regular basis, talking to them all the time. Sometimes you have to carry food for them, drop the food by the door, have a conversation. The more important thing is contact, and doing that contact safely and making use of the technology that does that. Use your phone, use your computers, stay connected through Zoom. Do all the things that you're required to do. This is a quick example. I have a colleague of mine who works in my office. One of her family members contracted COVID, and they had to stay in the same home together. They did not see each other for 21 days.
Wow.
Right? That colleague's family members stayed in the room, never left the room, but they stayed in contact. They kept talking, they were on the phone, they were all the technology, they made use of it. But for 21 days, they didn't physically see each other, but still they stayed connected. So that's what you have to do.
Now, I came across this term called COVID waste, and I wasn't quite sure what it means. What is COVID waste?
Yeah, COVID waste is all of the things that you generate in dealing with someone who's COVID positive. So whether it's clothing or things you use to clean the individual, if you have to do that, anything that they use that you have to discard, that is considered COVID waste. And the reason so is because it is likely to be infected.
Right.
And so you want to make sure that you treat it in a way that it does not itself infect others.
It doesn't become the vector for further infection.
Correct.
And these things. And when it comes to diet and medicinal tips for COVID-19 patients while at home, what advice can you give, doctor?
Right. So once a patient, your family member is still home, we recommend a lot of fluids, keep the person well hydrated, and keep the nutrition up. Those things are very helpful to making sure the person recovers. We certainly recommend things like Panadol if your person has a fever and pain, which sometimes a lot of the clients do have, but nothing like starting antibiotics and not getting into that kind of medicine. If you have to get there, that person probably does need to see a doctor. But the things that we recommend, lots of fluids, making sure the person get the fluids in as much as possible. And sometimes that's difficult because the person doesn't want to drink, don't want to eat, but we have to try and encourage them because those are the things that will help the body to recover.
Now, when it comes to the care of patients in hospital now, considering we've been in this pandemic and the medical staff would have had to have been dealing with people for like 15, 16 months now. What advances have been made in the care of patients at the hospital? COVID patients, that is.
Right. Well, I must admit, Gary, I would love for one of the internists to be in this call to answer that question in detail. Right. So I'm not going to give any details on that, except to say that what we have been doing in the hospital is consistent with what we have seen, certainly in the Caribbean and around the world. And those measures have been very helpful and successful. And as the information comes out about COVID-19 and how to treat it more successfully, I think we're going to start to employ a lot more of those more advanced measures.
Now, what's your take on retrovirals, and have they done any studies or have they done any observation to see whether those help individuals who are COVID patients?
Yeah, I think those are still ongoing. Part of the challenge with the newer research is just that it takes some time to catch on, right, and to lay hold. And you have to be able to establish its effectiveness before you can start to say, let's use this in a way generally to affect people. So the research and the verdict is pretty much still out on those.
Let me ask you a left field question.
Left field, right.
Now, the COVID-19 is one of the members of the coronavirus family, of which the common cold is also a member. Right. Do you believe that there would be at some point a vaccine or a cure for the common cold, considering the research studies and effort that has been done toward fighting COVID-19?
It's possible. I think viruses have been shown to be notoriously adept at adapting, right? And that has been the challenge, I think, for a lot of the viral illnesses we have. I mean, the common cold, for example, part of the challenge with the common cold is that it moves between species all the time, between human and the animal kingdom. And every time it comes back from the animal kingdom, it's a different virus. So, you know, it is part of the ability of the virus to adapt that makes it very difficult to even find a long-standing permanent cure.
Well, thankfully, the death toll that the common cold causes is, well, I don't know the figures myself, but compared to COVID-19, it's much lower, I would assume.
Yeah, right now that's the case. It wasn't that way when the COVID-19 pandemic started. Right. But certainly now that is the case.
All right. Well, Dr. Osafo Fraser, I want to thank you for your time this morning and answering my 1,000,001 questions.
And the left field questions.
And the left field questions as well. But I want to thank you. I want to ask you to continue to be safe. And, you know, we'll call on you again when we have 1,000,001 more questions, including some left field ones.
Yeah, sure. No problem. Thank you very much. And just a final word. Remember, if you haven't yet got your vaccine, once it becomes available, make sure to take it. Vaccines really do save lives.
Definitely. Thank you so much, Doctor.
All right. Bye.
All right, that's Dr. Osafo Fraser, who is the County Medical Officer of Health of St. George East. And we were speaking about full vaccination and things along that line, and caring for COVID positive patients at home as well. You can always look back on our Facebook feed if you have missed anything. But for now, though, we're going to take a short break and come back with much more right here on the Now Morning Show. Stay with us.